Josh Lampert. I'm a board certified plastic surgeon here in Miami, Florida, and a lot of patients have been asking me about fat transfer, liposuction, how do you do fat transfer, what's a cannula? So I just want to show you guys some cannulas. So I got a bunch of them laid out, okay? Tumescent based liposuction, or what most of us use, starts with this cannula. A cannula is basically a long, blunt metal needle that's usually a little bit thicker. And in order to use this instrument, a tiny incision must be made in order to fit this instrument in through the skin into the fat below the skin. Tumescent liposuction involves injecting usually a solution of numbing, and we also put adrenaline in. The adrenaline helps decrease bleeding during the procedure. And if you can zoom in on this one and see, this one has really tiny little holes. So with these tiny little holes, you could never suck fat out. This is made for infiltrating or for injecting the numbing solution in before we do liposuction. So this is an infiltration cannula. They come in different sizes depending on what you want to do. So this is what we use before we actually remove fat, and we inject a numbing solution in with these two cannulas. Okay, so that's an infiltration cannula. Next, when we want to harvest the fat, we let that local anesthetic and the adrenaline sit there, and it does its thing. It numbs the tissue, it decreases bleeding because adrenaline causes vasoconstriction, so there's less bleeding when you do the liposuction. So then again, through those same incisions, the incisions have to be a little bit larger depending on the thickness of the cannula. If you look at the difference of this this is a cannula designed to harvest fat through really small holes. And then this is a cannula that's much larger and more disruptive to break up fat. And with this type of cannula, maybe we're less concerned about fat survival, because if we're suctioning fat out in chunks that big, we usually can't inject it as well. So when we're harvesting fat to inject it, we usually like tiny little holes. So those tiny little holes allow us to harvest in smaller aliquots the fat and then inject it. So basically these cannulas, again, cannula is a blunt, a little bit bigger needle, small incision, again through tiny little incisions that are big enough to fit maybe 3 to 5 millimeters, big enough to fit this cannula in under the skin. We can harvest the fat, or if we want to throw fat out, we could use a bigger cannula like this with big holes, bigger cannula. This is a much more aggressive cannula when we're removing deep fat. If we're trying to really do some contouring or something a little bit finer, we would use a finer cannula like this. Now there's all different types of cannula shapes and sizes, but essentially these cannulas are made to suck fat out, and then the smaller holes are made if we want to use that fat later to do fat transfer. Now if you notice, these cannulas, they're different at the base, and the reason is this is a manual or hand cannula. This is something that I would hold in my hand and I would do liposuction if I do not want to use the power assist liposuction equipment that we have. And I usually use this for smaller areas of liposuction because it's just a little bit more work, and not for areas I like to do fat transfer. That's just personally what I do. These, which have a little area that snaps into a machine called a power assist lipo device, and that with a push of the button mechanically oscillates, and it's nice because it is not very traumatic, it doesn't burn. It's a technology that I feel allows us to harvest more quantities of better viable fat. And you don't have to, like with this cannula, I wouldn't be saving any of that fat, or sometimes I'm just breaking up deep scar with something like this, but it allows us to do a lot more work, and it's a lot less work on my shoulder. And I think we can do finer, better work for bigger volumes using these power assist lipo devices. Now, once we get the fat out, if we want to transfer it, if we don't want to transfer fat, we put the liposuction on high pressure. We suction out high pressure. We're less concerned about the fat popping while we're sucking it out. But if we want to keep that fat alive, we'll suction it out again with fine little holes under low pressure, so it takes longer. And then we process it, and we can kind of go over that with another video with you guys, in a closed system, which is a low pressure closed system that mixes the fat with antibiotics. And then once we separate the fat, we inject it with a different type of cannula. So these are fat grafting cannulas, And you can see they're small cannulas. So people say, how do you inject the fat into the breast after you suction out and process? Again, a small incision. This is a little bit larger than, the largest IV. And so the incision can be pretty much like 3 millimeters, really small, just big enough to fit this in the skin. Sometimes those little incisions, we don't even put stitches in, they're so small. But then the fat is transferred in that little hole. That little hole is where we inject the fat. So you can see if we harvest fat with a cannula this size and we squirt it back out, it shouldn't clog this. But if we harvest fat with a cannula this size, a big chunk obviously is not going to make it through unless you do some further processing, which can damage the fat cells. So we would then insert this kind of under the skin, and we draw back and we put little droplets of fat, and they make these in different sizes. So this is a fat injection cannula. Now what's really cool, and I like to do facial fat grafting with every facelift, is this really cute little set over here. So this is my favorite one. It's the Grams micro fat transfer set. And we have basically all of this. It's not power, you do it by hand, but we have all of this in this tiny little set. So we have a tiny little infiltration cannula. So if I'm harvesting a little fat and I want to inject in the face later. So this is again, like that first cannula I showed, it's got tiny little holes. So with a syringe, I would inject the numbing solution with this. Then I've got a couple little tiny little fat harvest. Again, this is done by hand, so we're harvesting smaller amounts. Maybe we would just harvest 100 cc's. Maybe we would only inject 50 or 25 cc's of fat. Sometimes I do more, but usually probably around 30 cc's on average with the facelift. But if we're just doing tear troughs or the eyelids, maybe 8 cc's or something. So we harvest the fat with these, then we come back and we have a variety of tiny little fat grafting cannulas that have little holes that we would hook to small syringes where we would do smaller fat transfers. And these do, even though they're tiny and we use small holes, they do tend to clog a little. So we do have a little instrument that, if it gets stuck, we'll get that little clot out, but these are really fun and basically the same thing on a much smaller scale of all these instruments. And basically that's, liposuction and fat transfer 101.